For our checkup appointments, there are a few things that, if possible, we'd like our patients to do in advance. So before your appointment, you should receive an email with a link that takes you to a medical history form. It's really helpful if you can get that filled in advance. It will save time on the day. But if you can't, not to worry, just come a few minutes early and we can get you to fill that out at the practice on an iPad. For anyone who's new, or even if you're not new, if you've got anything specific that you want to go through with the dentist, it's always helpful to have that written down in advance. That way you don't forget anything and you can make sure that you speak to the dentist about what's concerning you and that problem gets explored further. When you come for your appointment, you'll be greeted by our receptionist. Do let them know that you've arrived so we know that you're here. And then when you come in, you'll be greeted by the dentist and they will talk through all your concerns to begin with. At the appointment, we don't typically do any treatment because we want to use all the time to make sure we cover everything and do your examination really thoroughly. So the beginning is spent exploring anything that you're concerned about, finding out what your goals are for your teeth, what your aims are with your treatments as well, and what kind of results you're looking for. And we will spend some time just discussing that with you. Then the dentist will do an examination. So there are several parts to this. Firstly, they're going to check your teeth really thoroughly. We'll take our time looking at everything one by one, also any treatment that you've already had, just to make sure it's okay, and we'll do this in a really comfortable way. Secondly, we will check the health of your gums because gum health is just as important as tooth health. So we always do a health check on that. And quite often we need to take x-rays as well. Again, these are a really good diagnostic tool, so we get all the information that we need so we can give you the right advice. There are a few things we'll also be doing which you may not be aware that dentists do. So we check the rest of your mouth to make sure other parts of your mouth look really nice and healthy. We look at things like your bite, your alignment, the colour of your teeth, any wear on the teeth, and we even do some checks outside the jaw just to make sure everything is healthy because everything's interconnected. Once we have all this information, of course our dentists are going to go through all the findings and we'll make some recommendations. So to begin with, we'll show you the x-rays just to help the patient visualise what's going on, help you visualise what's going on, and then we'll suggest what will be right for you. Of course, there'll be plenty of time for any questions, and then once we're happy with what we're going to do, our reception team will get you booked in. Sometimes patients wish to think about their treatment, in which case we've got a treatment coordinator on site who can always do a follow-up, or if you think of any questions when you go home that you've forgotten to ask her on the day, she will be able to answer those for you.